Lee Dellin, MD, PhD, Professor of Plastic Surgery, Professor of Neurosurgery, Johns Hopkins University. Introduction. All truth passes through three stages. First, it is ridiculed. Second, it is violently opposed. Third, it is accepted as being self-evident. Arthur Schopenhauer. The Why Should I Listen to This Book quiz. Make note of each truthful statement. When someone serves birthday cake, I like the piece with the most icing. There's a supersized jar of Excedrin in my office desk drawer. I've had a medical procedure with the suffix ectomy. I could lose a few pounds, but I don't need another diet book. They don't work. Sometimes at night my feet itch or feel tingly. Every winter I have a runny nose. Every spring I get sinus headaches. I love anything crunchy or salty and can drink olive juice straight from the jar. I'm often tired. In fact, I could take a nap right now. My parents and/or grandparents had diabetes. I like my toes and want to keep them. Scoring. 1 to 2 items. Let's consider denial. 3 to 4 items. Not bad, but you should continue listening. 5 to 10 items. Forget about the weight you'll lose. This book could save your life. So what's the book about? My purpose is to get your attention, to demand you recognize how sugar chemically causes inflammation that damages your nerves, results in excruciating pain often made worse by prescription drugs, and will inevitably kill you before your genetic timetable. Carbohydrates, sugar, plus trauma equals nerve damage, pain, and dysfunction. This is the sugar crush, and it begins with subtle clues such as having too many headaches, a runny nose, adult acne, and a diet full of salty snacks, chocolate, and processed foods. I'm asking you to derail the express train taking you straight from sugar to peripheral neuropathy, then onward to diabetes, cardiovascular disease, stroke, and many other neurologic disorders, including multiple sclerosis, MS, migraine, carpal tunnel syndrome, and Alzheimer's disease, to name a few. Why a podiatrist? Peripheral neuropathy is the clarion call I witness every day, and it's noisy. It's what literally wakes you from your sleep. It is painful. Like hot needles, it stings and it burns. It starts in the autonomic nervous system of your legs and feet, then onto the sensory fibers, and finally lodges in the motor fibers. Nerves in the peripheral nervous system, all else besides the brain and spinal cord, signal your body to first feel and then move. That's usually when I'm called in. As a young surgical student in Philadelphia, I experienced my first amputation to remove a gangrenous leg from a man suffering with diabetes. Even though I'd spend the next 30 years as a podiatric surgeon and conduct tens of thousands of foot surgeries, including amputations on patients with diabetes, this first gruesome procedure is the one I remember most. I was the third assistant. My job was to hold the rotting leg as the orthopedic surgeon sawed it off just above the knee. The stench of a gangrenous leg is putrid and overpowering, so much so that we had to put peppermint oil in our masks to endure it. As I held the leg and struggled with the smell and the sound of the saw, I was struck not only by the impersonal, awful nature of the procedure, but by the enormous weight of the diseased leg as it fell into my arms. I stood confused in the middle of the room. Clutching the heavy burden and wondering what to do with it, I saw a nurse nod toward the medical waste container. No longer viable, this once healthy, functioning leg was now trash. That amputation was the end result of diabetic peripheral neuropathy, precipitated by pain and numbness, caused by damage to the nerves of the foot. Had we not removed this man's grossly infected leg, the gangrene would have killed him. But how did it get to that point? This is the question that eventually led me to write